How to fix ectropion, recessed eyelids, and burning sensation in the eyes and eyelids. After a Phoenix area-based ophthalmologist performed blepharoplasty, for the past 7 months I have been living a miserable life. I have ectropion, recessed lower eyelids, extreme dry eyes, painful eyelids and eyes, with burning sensation, and general discomfort and irritation, making it hard for me to work. I saw from the first doctor's report that he also removed some muscles and tissues. A competent surgeon has advised that he can try a skin graft to raise my eyelids. I don't know how my prognosis is.
Thank you for your question. You submitted a question without an image, but in your question you do detail some important factors that are concerning regarding your situation after undergoing cosmetic eyelid surgery. You state that you had developed an ectropion, you had developed some eyelid recession. Basically, there was some skin removed, some muscle tissue possibly removed, and you've had some opinion where there was advice about a skin graft. And at this point, I think you're concerned, of course, about the health of your eyes. You describe as painful and red. And basically, I think you're trying to get a handle on what is the most appropriate procedure, even though you did not submit a photo. Well, I can certainly give you my perspective as a specialist, a little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I specialize in revision surgery after cosmetic eyelid surgery, whether it's upper or lower eyelid surgery. In fact, patients come from around the world for exactly these types of problems, and I've developed my own approach, which I think will be meaningful as I explain the basis for my approach. So to begin with, it is important to understand that the lower eyelid is actually deceptively complex when it comes to eyelid surgery, and that it is still fairly common for people to have complications of the lower eyelid surgery because from my perspective, there's a wide range of doctors who perform these procedures, and periodically what was always a reliable approach, for example, like the external approach for a lot of doctors, unfortunately results in some of these complications. And so essentially, when we think about a complication of surgery, whether it's eyelid surgery or any other type of surgery, we essentially our goal is to restore anatomy and to restore both the appearance and the function. So before explaining how I typically address this type of situation, I'll basically first give you some very simple understanding of the anatomic principles. You see, the lower eyelid actually is, as I said, complex in its structure, and any type of imbalance in that structure can result in a malposition or an undesirable position that can cause exposure of the eyes. So for example, we'll start with the front of the eyelid. The front of the eyelid, often referred to in our field as the anterior lamella, is basically the skin, and I think you can also include the orbicularis muscle, the muscle that supports the eyelid. So in a scenario such as an absence of skin can cause the eyelid to evert or cause an ectropion. There can be situations when there's tension and pulling on the lower eyelid that can also cause the same type of scenario. Now there's basically also a middle lamella, which we refer to as the septum, and that particular structure in a way acts like a pillar in a way to support the lower eyelid, even though when you come across it surgically it's very, very thin. But I'll explain further after I describe the posterior lamella. The posterior lamella is basically the conjunctiva and lower eyelid retractors. Again, a compromise in the integrity of this tissue can result in essentially a collapse. So when we think of the eyelid, we think of the layers as being individual layers that can be relatively thin, but together they form like a sandwich, which essentially acts like a pillar, and a pillar that vertically supports the eyelid. Then another important anatomic element is the lateral canthal tendon, and this is the tendon that holds up the eyelid to the bone in the outer corner. So the strategy of surgery is to restore anatomy, and so it involves a proper examination where you determine, basically asking the most simple questions. Is there enough skin in the front of the eyelid? If not, you need skin. Is there enough support to the lower eyelid? Usually, especially in eyelid retraction, in my experience, usually that's a big issue, and therefore you need support from the inside. And that typically requires some type of grafting procedure. And there are a lot of different options for the types of grafting. Now, the last part is, of course, the lateral canthal tendon. Is the eyelid stable enough to be able to anchor to the top layer of the bone called the periosteum, or is it necessary to create what's called drill holes and place stitches to hold up the eyelid? This is pretty involved, and this does require a lot of, in my opinion, a lot of experience, of course, in this area. But I think that it's also important to understand the person's individual course of healing. You know, in surgery, we put things in the right place, but then we rely on a patient's ability to heal. Now, there are factors that can contribute to undesirable healing. One of the most important is cigarette smoking or smoking in general. Basically, when people smoke, they're not only creating issues with their lungs, but they're basically generating free radicals which can create a lot of inflammation, which is not favorable and can disrupt proper healing. They create carbon monoxide, essentially poisoning, and diminish the amount of oxygen delivery to the tissue. And since smoking affects the small vessels, it can also affect the proper healing. So one of the things that, in line of that, and not necessarily specific to smokers, I use a lot of technology that's from the regenerative medicine field, such as the use of platelet-rich plasma and extracellular matrix, to help expedite the healing for my patients so that we can maximize their ability to heal properly and leave less to unpredictability. So understanding the principles of eyelid retraction and ectropion can guide you as to the basis for what a surgeon is proposing. I find that a lot of times people want to, and naturally want to take, when they hear these types of details, they pretty much feel like they're overwhelmed, and often they'll say, can't you just put a stitch and just pull it up? Well, that's usually, when a situation is more advanced, it's not going to work. And a lot of times people come to me after they've seen me, and then they went and had other procedures, such as different ways to try to pull the eyelid up, and they end up with more scars and worse off than where they started. And essentially, if you have to try to wrap your mind around these ideas and understand that there are no shortcuts. There can be limited procedures that might give you a little bit of improvement, but generally speaking, understanding restoring anatomy is critical. A lot of times people are afraid of skin grafts and the term skin grafts, but there's an art to doing this and understanding that there is going to be a healing process, but it is the necessary choice in order to achieve an outcome with a timeline that goes to 1 year, not to 1 week. So I would recommend that you meet with qualified, experienced oculofacial, plastic, and reconstructive surgeons, those of us who specialize in this type of area, who have a lot of experience with complications of eyelid surgery, and learn about your options so that you can at least have a good sense of understanding of what is involved and be able to commit to the plan in a way that makes sense to you and that you understand, and work with the doctor so that you ultimately achieve the best outcome for this unfortunate consequence. So I hope that was helpful. I wish you the best of luck, and thank you for your question.